amigos, feliz viernes. Hoy es viernes. Yo soy Rory. Estoy contento de estar aquí contigo. So last week we looked at the 16 common causes of abdominal pain in Spanish. And this week we're looking at the 9 less common causes of abdominal pain in Spanish. Entonces tenemos mucho vocabulario para órganos aquí. We're going to take a similar tack this time. We'll talk about some basic vocab, and then we'll go cause by cause, explaining what's going on. Okay, signos y síntomas básicos. We saw all these last week, but let's review them real quick. So, dolor, it just goes with pain. Dolor leve, light pain. Dolor moderado, moderate pain. Dolor fuerte, like a heavy, strong pain. Dolor repentino, sudden pain. Dolor agudo, sharp pain. Dolor sordo, dull pain. Dolor después de comer, pain after eating. Dolor con presión, with pressure. Dolor sin presión, without pressure. Dolor con movimientos específicos, so pain with a particular specific movement. Dolor al orinar, so pain with urination. And then we've got nausea. Vómito con sangre, vomiting with blood. Diarrea con sangre, bloody diarrhea. Estreñimiento, constipation. Fiebre, fever. Gas abdominal, abdominal gas. Eructos, burping. Cambios en la regla o menstruación, so changes in your period or menstruation. Cólicos, menstrual or belly cramping. Aboltagamiento is being bloated. And so estar hinchado, being like swollen. Está inflado, being kind of inflated, all sort of meaning bloated. Ardor, and a burning sensation. We also looked at preguntas de la historia y el examen físico, some history and physical exam type questions. ¿Cuándo empezó el dolor? When did it start? ¿Cuándo está peor? When's it worse? ¿Cuándo está mejor? When's it better? ¿Hay algo que lo mejora o empeora? Is there anything that improves it or worsens it? ¿Ha tenido ese dolor antes? Have you had this pain before? ¿Le duele cuando palpo o toco aquí? Does it hurt when I palpate or touch here? Dígame si algo le duele. Tell me if something hurts. El dolor se asocia con, is the pain associated with lo que come, what you eat? Sus reglas, your periods? Movimientos específicos, any specific movements? Acuéstese, lie down, boca arriba, mouth up, boca arriba. Basically, lie down on your back. Voy a escucharle el abdomen. I'm going to listen to your abdomen. Relaje el abdomen, por favor. Relax your abdomen, please. Okay, so historia, examen físico. Pain. Descriptions about intensity and types of pain is a whole nother topic. In fact, we've got a whole nother lesson built on this. Here's the link. Make sure you download this lesson's notes, and then you can just follow this link right off to the pain lesson, okay? All right, so let's get started with las 9 causas menos comunes, the 9 less common causes. Appendicitis, appendicitis. Infección de riñones, a kidney infection. Cálculos renales, so kidney stones. Hepatitis, hepatitis. Cálculos biliares, so gallstones. Cáncer del estómago, so stomach cancer. Hernia, a hernia. Quistes, cysts. Torsión ovárica, and ovary, like a twisted ovary, okay? Let's get started with appendicitis. Appendicitis. El apéndice, the appendix, es una parte del intestino grueso que no tiene una función necesaria. It doesn't have a necessary function. Hay algo que está bloqueando el apéndice. So there's something blocking the appendix. Y los contenidos no pueden salir, and the contents can't leave. Por eso se ha infectado y está inflamado. That's why it's infected and it's inflamed. El apéndice puede romperse. So the appendix can burst. Y el contenido de los intestinos van a causar una infección en su abdomen. So it can burst and your intestinal contents can cause an infection in your abdomen. En este momento podemos darle antibióticos. In this moment we can give you antibiotics y esperar que se abre and maybe hope that it opens, right? Si no, necesitaremos hacerle una cirugía para quitarle el apéndice. If not, we'll have to do a surgery to remove your appendix. Okay, infección de riñones, so kidney infection. Una infección de vejiga es común, pero a veces esta infección puede extenderse a los riñones. So a bladder infection is common, but sometimes that infection can extend up to the kidneys. Causa mucho dolor y puede dañar al riñón si no lo tratamos. Causes a lot of pain, can damage the kidney if we don't treat it. Necesitamos darle antibióticos intravenosos. We need to give you IV antibiotics, es decir, por suero, by IV. Hacerle un ultrasonido o un TAC, so do an ultrasound or a CAT scan, para ver si hay cálculos también, to see if there are any kidney stones as well. Speaking of kidney stones, cálculos renales, la orina pasa de los riñones por los uréteres or tubos a la vejiga. So urine passes from the kidneys through the ureters or tubes a la vejiga, to the bladder. Una piedra o un cálculo está estancado en el útero, en el uréter, uréter, not útero, en el uréter o en el riñón y le está causando mucho dolor. So a stone or a small calculus está estancado, is stuck in the ureter or en el riñón or in the kidney, and it's causing a lot of pain. Esto puede causar una infección en los riñones. So this can cause an infection in the kidneys. Necesitamos hacerle un TAC para ver el cálculo. So we need to do a CAT scan to see the stone, kidney stone. Darle medicamentos para el dolor, give you pain meds. Y si no puede pasar el cálculo, if you can't pass it, es posible usar ultrasonido para romperlo. We could maybe use some ultrasound to break it up. También hay un procedimiento con láser. There's also a laser procedure para romperlo, to break it, si el ultrasonido no funciona, if the ultrasound doesn't work. Hepatitis. Es un virus que ataca las células del hígado. It's a virus that attacks your liver cells. Hay varios tipos de hepatitis, A, B, C, and then D and E también. We're not going to look at D and E today. We'll just look at A, B, and C. Hepatitis A es un virus que contraemos por comer comida contaminada. We get this by eating contaminated food. Muchas veces son mariscos. They're often shellfish. Hepatitis B, este virus es más serio. This is more serious. Se contrae de fluidos del cuerpo. You get this from body fluids. Pueden ser fluidos sexuales. These could be sexual fluids. Y puede pasar de mamá a bebé. And they can pass from mom to baby. Hepatitis C es un virus que se contrae por la sangre. This is a blood virus, right? Normalmente es a través de las jeringas. It's often passed by needles. Continuamos with some tratamientos. Hepatitis A, le podemos dar cuidados de apoyo. We can give you some supportive care para el dolor, for the pain. No hay cura, there's no cure. El cuerpo puede eliminarlo por sí mismo. The body can get rid of it on its own. Hepatitis B, hay algunas medicinas que sirven más o menos para hacer al virus dormirse y para suprimirlo. So for hepatitis B, there are some medications that make the virus kind of go dormant and suppress it. Hepatitis C, hay medicinas nuevas que pueden eliminar el virus. So you have some new medications that can get rid of the virus. Pero usted tiene que abstenerse de drogas, but you have to abstain from drugs y alcohol. Pero usted tiene que abstenerse de drogas y alcohol por 6 meses antes de dárselos. But you have to get off of drugs and alcohol for 6 months before taking the medications. Cálculos biliares. Okay, so gallstones. La bilis se produce en el hígado, so biles produced in the liver, para la digestión de comidas grasosas, for fatty food digestion. La vesícula es donde el cuerpo almacena la bilis. So your bile is stored in the vesícula. Cálculos pueden formarse en la vesícula y causar mucho dolor. So these stones can form in the vesícula, in the gallbladder, and cause a lot of pain. Las mujeres mayores de 40 años que tienen hijos, so women over 40 with children, y que tal vez son sobrepesos and maybe are a little overweight, son más propensas a padecer de la vesícula, are more likely to have gallbladder problems. No debe comer comidas altas en grasa. You should not eat high-fat foods. Si hay una infección, necesita una cirugía. If there's an infection, you'll need surgery. Cáncer del estómago. Es uno de los cánceres más comunes del mundo. It's one of the most common cancers in the world. Se presenta con dolor de estómago. It presents with stomach pain. Sentimiento que está lleno sin comer mucho. So a feeling of being full without eating much. Bajar de peso, losing weight. Sangre en el excremento, bloody stools. Y vomitar con sangre, and vomiting maybe with blood. Si está descubierto temprano, if we discover it early, podemos hacerle una cirugía. We can do a surgery para quitar una parte del estómago, to take out part of the stomach. También le podemos dar quimioterapia. We can also give you chemotherapy y cuidados de apoyo and some supportive care. La hernia, hernias. Es un defecto o punto de debilidad en la pared abdominal. So it's a defect or a spot of weakness in your abdominal wall. A veces es problemático y sintomático. Sometimes it's problematic and symptomatic cuando los intestinos pasan por la hernia, when the intestines come out through the hernia. Los intestinos están apretados, the intestines are squeezed, lo que causa que la sangre no puede circular, which causes the blood not to be able to circulate through the intestines por los intestinos. Hay dos soluciones. Espera vigilante, so like watchful waiting, es decir, vigilamos a los pacientes sin síntomas, so we can watch patients who don't have symptoms, y esperamos para ver si se resuelve, to see if it resolves, wait to see if it resolves. O dos, cirugía para cerrar la hernia, so surgery to close it. Quistes en el ovario, so cysts, ovarian cysts. Los quistes son sacos de fluido. These are fluid sacs o sangre or blood sacs cerca del ovario, near the ovary. Pasa con frecuencia, so it happens frequently con ovulación, cuando el óvulo sale del ovario. So when the egg leaves the ovary, this happens frequently. Los quistes pueden romperse, they can burst, y por eso hay que hacer ultrasonido para ver si ha roto. So we need to do an ultrasound to see if it has broken or burst. También es posible una cirugía laparoscópica para quitar el quiste. So we can do some laparoscopic surgery to take the cyst away. Torsión del ovario, so like a twisted ovary, right? Es peligroso cuando el ovario gira sobre sí mismo, when it twists on itself, porque puede privar el ovario de la sangre que necesita, because it can limit the blood flow to the ovary. Masas, so masses como quistes like cysts y otras cosas pesadas, and other heavy things like un embarazo ectópico fuera del útero, like an ectopic pregnancy pregnancy outside the uterus, pueden provocar la torsión, can cause that torsion. Es necesario hacerle un ultrasonido. We have to do an ultrasound y probablemente una cirugía para enderezarlo, and probably a surgery to straighten it back out. Okay, that's the 9 less common causes of abdominal pain. Para conversar, choose a few abdominal pain causes and practice the following with your partner. First of all, talk through their symptoms and pain, okay? Secondly, give the diagnosis and a brief description of what's going on. And third, finish by explaining a few next steps for your patient. Hey, if you learned something today, make sure you like this video, subscribe to our channel. That's how we're able to keep doing this, by other people watching and sharing and building our community. So if you need a conversation partner, thinking of community and others who speak Spanish, learning Spanish, head over to the Learning Medical Spanish Facebook group. Put yourself out there. Say, hey, I'm trying to practice some Spanish. Who is available to chat with me? And if you've got questions, be sure to post them in the comment section below. We'll be happy to answer them for you. That's it for today, amigos. Gracias por aprender español conmigo. Juntos mejoramos comunidades. So, para más español, head over to the website, commongroundnational.com. And if you'd like to take some free medical Spanish terminology tests, head over to Certified Spanish. create your free account, and take as many terminology tests as you would like. Okay, amigos, gracias otra vez. Nos vemos la próxima semana. Chao.